My name is Dr. Ed Harlemert. I'm the Director of Cardiology at IU Health Saxony Hospital. What led us to be interested in working with IU to build a new cardiovascular hospital in Fishers was the actual desire of Indiana University Health to expand its wonderful high-tech cardiovascular services that they offer in a medical school and in a university setting, but transported out into the suburban areas. It was an exciting project for us at that time. It was exciting to work together to build a private practice feel in a high-tech university hospital cardiovascular program. Well, it's an exciting time to be in cardiology again. As you know, the concept of unclogging an artery with a metal stent that happens to also be coated with a drug and then deliver that drug right to the spot where your artery developed cholesterol and clogged up, made cardiology safer and more applicable. And you could even take it into the local community center and actually fix a person's heart very quickly. The excitement phase of what's happening now, though, is those metal stents we know, although good as they were, leave behind that little trace of metal in the artery. And the body doesn't necessarily enjoy that the rest of its life. So they've invented a type of stent that will actually dissolve over about a year after it's placed. It's a new technology. IU Saxony Hospital is going to be the first suburban hospital, if you will, to be able to place those in your heart. Cardiology by itself has a ring to it, but also an excitement to it that has been very beneficial to all of mankind since the 1960s. The interesting focus I think that you're seeing now is that fortunately it's becoming less and less invasive. So the future of cardiology will be we as doctors will be able to fix your heart by making smaller and smaller openings in your body to get up there and work on it. Over the next 10 years, I think we'll see dramatic improvements in nutrition and medications that are going to prevent your arteries from clogging up in the first place. And Saxony Hospital, IU Health Saxony Hospital, is going to be one of those places that you're going to want to come to just to prevent ever getting heart disease first and maintaining your health. We end up developing a one-to-one relationship with our patients, their family members, their kids, and that one-on-one relationship for life with the doctor and the patient makes sure that you have the trust that whatever technology can be done next, whatever treatment needs to be done next, even if there may not be a perfect treatment for you or your family member, at least you'll have the hope that this doctor cares and this entire hospital cares and will do the best they can to make you better. By age 50, I would say that most of us develop a gradually increasing risk of developing heart disease. And my plea would be to not ignore that. Heart disease and heart health are so easy to obtain now. They're easy to obtain in other locations in Indianapolis, but they're very easy to obtain here at IU Health Saxony Hospital in Fishers. There's ease to access, it's a small hospital, and you really feel like you're walking right into the front door and up to your doctor. So it's not something that should be feared. I think many of us put this off. We put off thinking about the possibility that maybe we could have a heart attack someday like our father did. And yet we don't fear going to the dentist twice a year all of our life. Your heart is an important part of your body. It's perhaps the most important part of how we work and live. And I think if you value anything, you should value your heart. And at Saxony Hospital, fixing hearts is what we do best.